think it's, indicative of that larger shift of wanting to show up to work, show up to other spaces in your life as your whole and authentic self. And that means that there are going to be days that you're not okay. And the societal pressure to express that, I think it's a positive move and a positive shift. Positive, negative. I think it allows for someone to really be their authentic self. And this isn't to say that there isn't a space or a time for it, and there is, but being able to have that space and being able to express, I'm really not okay today. And it's hit me, there's something that happened last week and it hit me. Being able to provide and hold that space, whether that's tangible or psychological, I think has a real impact on mental well-being.
All right, guys, welcome back to a brand new episode of the HR Heroes podcast. I'm incredibly excited because I have Anna here with me today. Anna, thank you so much for joining the show.
Thanks so much for having me on, Keenan.
Of course. I like to start off these interviews by asking a simple question. How is your heart doing today, Anna?
My heart is doing well. Yeah, it's going well. Grateful, calm, compassionate.
I love those. What does compassionate mean to you?
Compassionate goes a little beyond empathy for me. When you empathize with someone, you understand, you can maybe understand their situation a little bit, but compassion is that extra step, going a little beyond that. And, for people that I interact with and support on a daily, and especially interacting with them, my compassion is beyond that empathy step, really relating and really sometimes experiencing exactly what they're experiencing, taking in that energy as well.
Why do you think it's so difficult for us to be compassionate for others? It seems like in the world of society that we live in today, everything is so divisive and it's so difficult to put ourselves in somebody else's shoes. Why do you think that's happening?
I think there's so much information that we absorb every moment, information overload. We don't really have the chance to kind of pause and think about what we've just heard, what we've just seen. It's always the next deadline. It's the next task. It's what's next. It's hustle, hustle, hustle. And, I think we're not in that moment. And when we're not in that moment, it prevents us from really listening and understanding. And, it's just whatever we can get in that 5 seconds, the sound bite, the headline. And I think that's a contributor to not the willingly lack of being compassionate, but certainly something that, takes away from I'm going to the next thing.
I mean, it's incredibly difficult for us to be present in today's world. One of my favorite books is a book by a guy named Dan Sullivan. He's an executive coach, and he talks about, the name of the book is called The Gap and the Gain. I'm not sure if you've ever heard of it, but there's an analogy that's used throughout the entire book, and it talks about people who have big goals for themselves, have a high achieving mindset, often find themselves in the gap. And the gap is described as where we are here right now and the moving, I would say, finish line of the horizon. Getting from here to there makes us feel like we have to hustle, like we have to move as quick as possible to get there. But one of the things that he says is if you look at the finish line as the horizon, you can run, you can walk, you can jog, you can sprint, you can even fly in a plane as quick as you want towards the horizon, but you'll never catch it. And often, sometimes what we have to do is stop thinking about what the gap is from here to there and think about the gain. The gain is described as everything that we've accomplished from where we started to where we are right now. And that sense of gratitude, I feel like, is a great grounding practice for being present. And I feel like you said, so much comes at us from a hot and heavy perspective of media, notifications, breaking headlines, all the stuff that we consume, that it's very difficult to be here right now.
And I think it's, I like that you mentioned sort of that gap. I think it's really that moment that you take to pause. we're advancing in technology in so many different spaces at a really rapid pace, and it's taken the time, and it still continues to take the time for us to really catch up, because like you said, you're going towards that horizon, but your thought process is still not there with you. So it is it resonates.
It's very interesting. I had a former guest on the podcast. His name is Chris Gillett. He's the former VP of Global Employee Engagement for DHL. And he's always been somebody in the logistics space. And he talks about how he's all about efficiencies and getting rid of waste and being as proficient as possible in all of the experiences he has in life. And he told a story about the impact of technology and how quickly it gets away from us as a society. He used the story to be able to narrate this. He said, I went to Asia. And if you've been to Asia, you see how westernized these countries are attempting to be. And he said, I went to the airport and I saw the gate that we naturally pull up to, the little guard gate, where you push the button, you take your ticket, you go in. It creates efficiencies. But one thing that he saw there was that although they had 6 or 7 gates at the entrance to the airport, there was a person sitting on a stool who would literally push the button for you, take the ticket out, and hand it to you instead of you doing it yourself. And he used the example of, in the moment, he was like, this is so wasteful. There's so much wasted resources being used in this process. But then he started thinking about, what do these people do who don't have jobs that have been replaced by this? And often our society does not move at the same rate, if you will, that technology kind of escapes from us at. And I thought that was a really interesting concept to think about, because we're surrounded by so much technology. It moves so quick that often I feel like we're kind of at an inflection point where we don't have the time nor the understanding of how to actually keep up with that technology. And then how do we adapt to that as well?
Yeah, and maybe even a fundamental understanding of what the technology is. I think there's a lot of fear around technology. We talk about ChatGPT, we talk about generative AI. We all know that that's where we are. We're not even headed, but that's where we are. But there's so much fear around it because there's so much unknown. And how do we pause, and how do we analyze it from, and embrace it, and not so much fear it? Um, and I think that's going to be the challenge for so many industries, and I think a particular challenge in the HR profession as well, um, in really kind of understanding the impact, um, but also really championing the value, and how that could be a contributor to not just productivity, but just optimizing in all areas of our work lives.
It's interesting because, me and my company, we develop a lot of different pieces of technology. One of which is, over the last like 8 months, I would say, we've been very successful in developing conversational AI tools for the enterprise organizations we work with, specifically for HR. Now, what we do is we develop this conversational AI tool that's trained on the employee handbook, benefits, leave policies, everything like that, to free up the HR leaders to actually do the human-centric work that is needed instead of doing all of those redundant tasks. And it's an interesting conversation with a lot of these leaders, because when we think about the humanistic nature of business today, we think of HR, but that often is kind of threatened if we think technology is going to be able to take our job. But we always think about technology as being an accelerator, not a replacement, as technology has proven to be over and over again. But we really do have to kind of hone a sense of curiosity, if that makes sense, about how this can fit into our world, rather than saying, yes, this is going to be great, or no. It seems like there needs to be a blend in the middle, and we need to kind of go through the process of discovery, if that makes sense.
Completely, yeah. And I think that this year especially is sort of that foundational year for maybe some reinvention in some of these spaces, particularly in the people space and HR. Really owning in on getting back to the human piece of it, the human element, moving away, I think, from uh, sort of the silos and the specialized functions, and really embracing more of a um, solution area.
It seems like we need to get back to like first principles, if you were. Before there was HR, before there was DE&I, there were human beings who cared. And I feel like we need to get back to that space, because I feel like that's where society is asking us to be today, especially on the other side of the pandemic. I always talk about the new generation of workers, not Gen Z, not millennials, but everybody who's working today has different expectations for what work represents. Why do you think that we have such a different expectation these days for what work means in our lives?
I think the pandemic certainly highlighted it. Um, I think the trend had been really slowly inching towards more of a work-life harmony, work-life fit. Um, the clear line, especially with advanced technology, of this is what I'm at work now, and then that's over. This is my personal life, and as soon as I go into work, that changes. Um, I think that's blurred over the years, and I think with remote work, flexibility in schedules, all of the things that really came out because of the pandemic. Not that this was the catalyst, but it certainly highlighted, some of those trends, and that's not going away. So remote work isn't going away. The need for not just certain generations in the workplace, but across the board, um, to be for organizations and companies to be able to not react, but proactively be able to put in interventions and programs in place, to be able to cater to all of those different needs, to all of those different um, lifestyles. It's not just this generation, that generation. It's really vast. It's complex. It's diverse. And if we're going to say that we're looking to champion diversity, real inclusivity, resiliency, um, we're going to have to think about that and really personalize it.
I feel like in order for us to accomplish those things, we have to provide a couple things. And this is a perfect segue into our section of the podcast where a previous guest is going to ask you a question.
Uh,
So, in order for us to be able to provide kind of a vision, if you will, for the future, there are a couple elements: clarity, consistency, and care. I
mhm.
feel like when it comes to communication, those are three pillars that we need to be able to provide to our teams to give them a clear path towards the future. And so the previous guest on the podcast was named Amanda Karen, and she's a chief people officer for Chick-fil-A. And she wanted to ask you the question: when was the last time in your career that your team asked the question, how are we doing at providing clarity, consistency, and care for our team? And are you guys listening to those things? And what did you do with that feedback?
In my previous role, I had weekly meetings with team members who reported to me, but we also had, as a team, um, conversations on a weekly, bi-weekly kind of cadence, and there was always more of an organic conversation around how are you doing? Are we being clear? What's happening? And I think in the course of those conversations, organically, the feedback around clarity and consistency was, I'm not too clear on what we're doing. Um, and have we met that? Have we embraced that challenge? And, you sit with that feedback and kind of strategize on ways to address it. But I think, it's not something necessarily where you can sort of action plan, within the next 3 6 months, this is what we're going to do. But it certainly is a great question to continue to want to really think about, and let that be the driver for positioning HR and the people space to be able to really create that meaningful experience.
It's an interesting perspective to me because one lesson that I've learned is just because you say something, it does not mean that's what everybody else heard. And when it comes to communicating with your team, it's very interesting to think about how we think that we're being tactful and clear and kind of outlaying the vision. But often those things get muddled in our own head and we kind of have a different interpretation. So it's like we don't often have to be taught, but we just need to be reminded, is something that I always lean into with my team. And it's an interesting perspective to kind of think about how clarity of communication kind of unifies us and puts us on the same level playing field for what we're supposed to accomplish. And if we don't do those things, then obviously everybody's going to be running around and doing different stuff, which can be incredibly detrimental to the organization, which is just such a simple thing, but so important for us to be able to focus on.
For sure. I think about that too. And beyond just the style, I think method of communication is just as important, equally as important. as you said, you can say something and it could be interpreted different ways. I think it's also a matter of which um, you receive that communication. Is it going to be consistent across all those different methods? Um, Text versus email versus a Teams call versus a town hall. That message, that consistent message, cascaded throughout, is going to have that impact on the organization for sure. And that's always been an interesting um, exercise. And anytime I wanted to send any messages out, or there was a program or initiative that we might have been working on, that was always a question that was at the forefront. How do we do this? How do we communicate this in a way that makes sense to the population that we're trying to deliver the message to? And what did they get out of it? And how are they going to receive that? So it's super key as well. Just another example of personalizing that approach.
When you say population, I want to kind of dive into your lived experience, if you will, in being a HR leader in healthcare. So, over the last years, we've seen that the HR space, especially in healthcare, has been incredibly challenging. Lots of burnout, compassion fatigue, turnover, the list goes on. So, what are some of the key challenges that you kind of saw come out of the pandemic from an HR perspective in healthcare? What do you think?
Some of the stark ones are really those professions that um, you never think would change. Nursing, a lot of nurses leaving the profession, a lot of nurses going from a hospital or an ambulatory setting to a traveling situation, which really forced us to think about, okay, how do we not just attract talent, but how do we retain such a vital role? Um, and a lot of nurses who were retiring, and again, that's not specific to the pandemic, but compounded by lots of those who are leaving that profession. And it wasn't just nurses. I think in every role within a healthcare setting, they're all very crucial. Social workers, um, lab technicians, and so the changes propelled by the pandemic, by the vaccination mandate, resulted in a shortage in staffing, but also just thinking about the generation that was retiring and the loss of that knowledge. Played out very interestingly in, again, I'm going to go back to nursing. Nurses, new nurses rely on their preceptors, and these are experienced nurses who've been in the field for a long time, who are able to educate and train and orient them to a particular field and particular unit. And when that generation is no longer in the workforce, that's a knowledge gap. And so, really trying to think about, how do we change our approach in training? How do we change our approach in orientation? Because all of that led to other changes in work um, that had an impact on patient safety, on patient quality of care, volume. And so, again, that also leads to more burnout, turnover, um, and those are just some of those challenges that came out of what was propelled by the pandemic.
Yeah, it's something that I often don't think about. But when you were talking there, I think about the transference of knowledge from generation to generation is one of the biggest, I would say, hidden retaining elements of building a staff and building a team of knowledge. Because if you have a new nurse who comes in, what's going to happen? If you have an older nurse who is often going to say, let me show you how to really do this, because school often didn't prepare you to kind of work in this real world. And now that we have that gap, it seems like we're going to be fighting ourselves out of that hole for quite some time now.
Yeah, it's still something that we're looking at. Beyond just not having somebody on site, a lot of new grads didn't have that same opportunity to really practice their skills prior to graduation. During the pandemic, everything was virtual. So again, that knowledge gap starts there, and then it continues when you get to a hospital or when you get to a site. Um, and they don't have that same opportunity for training, and those that impacts uh, not just their experience, but then you have the next group of nurses that come in, and that kind of trickles down. So I think it's something that we've seen as a real stark difference, when you compare pre-pandemic and post-pandemic, orientation, training, and staffing.
Is it fair to say that there even might be a sense of resentment? So let's paint out this scenario. You have a new grad coming into an organization. The older nurses aren't playing the mentor, if you will. Is it possible that there's going to be a future where we have nurses who are coming into the space behind this new generation, and the older generation in that time is going to say, nobody helped me out when I got here, so you're going to have to figure it out on your own? It almost seems like a compounding factor that might not be in our favor.
Yeah, no, it's a really great point. I agree. I think I think to an extent that that's always existed in on some level, um, and I think there's value in the new nurses coming in, with so many different changes, and healthcare is evolving all the time, and there's always new best practices. So I think there's always been a level of that sort of, oh well, here's how we've done it before, and you got that opportunity, whereas I did not. Um, but I think in the moment, it certainly creates a lot more room for stress and for burnout, and I think that's a challenge that is going to be on sort of the leadership and HR agenda to really kind of tackle in the next however many years, because it's certainly, you know, it's a lot.
Where does our personal responsibility kind of come into this conversation? Because you recognize that stress, anxiety, burnout are at all time highs, right? And it seems like there has to be an element of personal authority to be able to kind of tackle some of these issues by prioritizing filling our own cup before filling others. And I know that in healthcare, especially, we always work with, nursing teams and administrative teams to help kind of reinvigorate and support their mental wellness, because people in healthcare are often the worst type of patients. So, where does the personal sense of accountability come in that takes the huge weight off of leadership to kind of, I would say, reinvigorate a culture of wellness and support and encouragement amongst our team members, instead of leaning on leadership to kind of, have the silver bullet, if you will, that's going to fix this problem for us?
Sure, I think there's a sort of multi-layered approach to that. I think I'll speak personally. I've had a challenge with filling my own cup and not feeling guilty about it, and really kind of setting those boundaries. I think by virtue of, I want to be the care, I want to care for the people who care. Um, and often my needs, or, my well-being will take a backseat. I'm not saying that's the right approach, not at all. I think there's definitely accountability there, and I, have to force myself to say, is this something that will allow me to put forth energy and time to resolving something, and really and creating a strategy, or is this going to take away from that? And if it's going to take away from that, then I'm going to politely and cautiously say, I can't do this right now, but I will look at it, in 2 days. Um, and I think it's a daily exercise. I think within the healthcare space, healthcare workers are probably the worst patients, but they're also one of the greatest peer support systems. So aside from just looking at senior leaders and administration to, as you said, have that magic answer for them, they work together. They see each other all the time. There is almost nonverbal understanding of when things happen. And so I think in that, the healthcare workers do take that accountability and personal sort of inventory very seriously, and they're able to then influence their peers. Um, I don't know if you are familiar with Code Lavender,
No,
but
fill us in.
yeah, so Code Lavender is actually something that was developed by the Cleveland Clinic. I think it launched officially in 2008. And essentially, it is a rapid response to a colleague or a peer who is going through some sort of distress in that moment, or as a result of an event that may have been, distressful, traumatizing. Maybe a patient was lost, a diagnosis, and allows for peers to really support that response and effort. And where I worked at Northwell in 2013, 2014, they developed a Team Lavender program. And I'll give credit to where credit is due. That was developed and championed by Agnes Barden. But essentially, a really wonderful model based on Code Lavender, um, where there are interdisciplinary teams that are involved in responding to these types of requests, or and it's done within a few hours or the very next day, and essentially you have a patient experience team, social workers, the leadership of that particular unit if it's a nursing unit, and HR being there as well to support, to offer support. We had, there's chaplaincy services or spiritual leaders who come to that unit and really just offer that support, even if it's a moment of just quiet reflection, and allowing the team members to really talk to what they're feeling and how they're feeling. And if it's not something that everyone wants to participate in that moment, but they want to come in at least, 5 minutes after, or they want to understand a bit more about what the resources are, they can do that. And I found that to be not just inspiring, but also very effective in having that support and really maintaining that accountability.
It sounds like a beautiful framework to be able to create safe spaces for people to be able to not be okay. And I feel like that's a huge element that we deal with kind of in the world of mental health today is we've always been programmed day after day, social media post after social media post after consumption of seeing everybody else who's doing great all the time. And it almost subconsciously teaches us that if we're not okay, then we are lesser than. And I feel like there's a huge shift that's happening in our society to prove to people that it's okay not to be okay. And the majority of us, if you look around out here, might be smiling, but we're probably not okay on the inside. So what do you kind of think about that societal pressure, if you will, to not be okay, and why things like, the Lavender Initiative are so fundamental in kind of translating safe spaces into work that kind of can then bleed out into our regular lives?
Yeah, I think it's indicative of that larger shift of wanting to show up to work, show up to other spaces in your life as your whole and authentic self. And that means that there are going to be days that you're not okay. And the societal pressure to express that, um, I think it's a positive move and a positive shift. Positive, negative. Uh, I think it allows for someone to really be their authentic self. And this isn't to say that there isn't a space or a time for it, and there is, but being able to have that space and being able to express, I'm really not okay today, and it's hit me. This something that happened last week, and it hit me. Um, Being able to provide and hold that space, whether that's tangible or psychological, um, I think has a real impact on mental well-being. And personally, I think that's a really great shift in our society. I think we, like you said, there's a lot of pressure to be okay and positive, and lift each other up. But at what point is that really authentic? And if at that point it's not, um, then maybe we need to talk a little bit differently. Maybe the conversation needs to change. And that's okay.
I've been messing around with a theory in my head, a framework, if you will, around practical optimism. Because in today's world, it seems like we're surrounded by more negativity and unpredictableness than ever. And it seems like a lot is outside of our control. But when I think about the idea of practical optimism, it is the ability to control how we react to a situation with a better understanding of the landscape, if you will. Because if we react positively in every situation with blind optimism, then that can be conceived as, I would say, toxic positivity. But practical optimism in itself is the ability to assess the situation, understand what is good, what is bad, and then control how we react in that moment to that instance or that scenario. What do you kind of think about that practical optimism framework?
I love it. I think it's also helpful in building that resiliency. Um, Recognizing that there is something to be optimistic about, um, but not to the point of just blindly saying yes and this is wonderful and this is great, because I again it could seem out of touch. And if we're moving towards really having that sort of work life fit and being authentic and presenting our whole self, um, without the toxic positivity, I think practical optimism, it helps.
It's an interesting framework. As you were kind of talking there, my mind went to the place for some reason of talking or thinking about kind of our societal lives that we live in, our personal lives have seemed to be blended, or the line between work and life in itself has become incredibly blurry. A great example is just outside the frame over here is my regular house. And so my office is inside of my working environment, which is very interesting to kind of think about, because unless you have the ability to establish those boundaries for yourself, to say, this is when I'm clocking in, this is when I'm clocking out, this is when I'm taking my break, it's very easy to become, I would say, overwhelmed with the consistent draw of this siren, which is my computer, because I'm always thinking I have to come back to it. How have you kind of, especially in the transition to moving to remote work, helped establish kind of those boundaries for yourself to kind of be able to turn off the switch of work at nighttime?
Yeah. So it's uh for the sake of transparency, that's been, a challenge. I think especially within the context of working in healthcare, um, working for supporting businesses that are 24/7. So there isn't just a hard stop at 5 o'clock. Um, and I think when I had the opportunity to kind of work remotely, um, it was a real conscious effort to, after a certain point of time, um, I'm not going to read that email. I'm gonna, if it's not marked as urgent and no one is calling me, that email will be read tomorrow during those working hours. But it was a challenge, and it's been a challenge. We're so used to being plugged in. I'm so used to being plugged in. Um, I think, you know, um, really being intentional in setting those certain boundaries. Um, I think that's where you mentioned, as you mentioned, the ability to clock in and out. I think, again, in healthcare, because so much of that is on site, or, you're caring for people who are coming to a certain facility. Um, that sort of boundary, or the ability to maybe just not think about that at the moment, compartmentalize maybe a little bit, that still exists, and it probably helps to an extent, in not just being completely overwhelmed and um, you know not really bereft of compassion, if that makes sense.
It really does. It's an interesting dichotomy, because the mission of healthcare in itself is often answered by highly empathetic people. My girlfriend is a great example of that. She's going through school right now. She'll graduate in November as a physician's assistant, and she talks about the draw of wanting to always show up for the people who she engages with every single day. And I found her many times talking about, it's very difficult for me to turn it off at nighttime because I'm always thinking about the people who I engage with. And it's almost like the dark side of the mission, if you will, because we're so tied in and we're always thinking about kind of how we can serve others. It's a very difficult dichotomy for people in healthcare, especially to be able to balance. And it feels like that's a huge reason for the burnout is we don't have proper training, or we've never been taught how to establish those boundaries, because our heart in itself earns to be able to serve the people who we think about and dump so much energy into on a daily basis.
Yeah, yeah, and you absorb those experiences. And from I could say from my own experiences in the HR space in healthcare, my goal every day was, how do I make it easy for this nurse? How do I make it easy for this social worker? How do I make it easy? Just how do I simplify it so that they're not spending their lunch break trying to get to somebody on the benefits team, or someone in HR isn't answering, um, because they don't have X amount of time. They have just this much to get what they need to get done during this break, and then they go back to saving lives. So how do I make this simple for them? How do I do this? And I would take it personally if I didn't live up to that expectation. Um, that I set for myself. It's not something that, but it's almost because I put myself in their position, and how would I feel? And so I've absorbed the experience there, um, and it's not easy, turning it off. I found myself staying up late at night to think about, okay, how did I do that differently? Maybe I'll do that differently. How was that conversation? Maybe I'll check in with them tomorrow. That's something that's constant, and so I get it. It's not hard. It's not easy to turn off, but it certainly does contribute to that sort of burnout, or I'm not going to say, there's stress, but it really is more of a sort of a feeling of being depleted.
Mhm. I think it's a lack of almost like perceived agency, if you will. I mean, when I think about the pandemic in itself, the ability for us to show up to work every single day and there not to be an end in sight had to be incredibly emotionally draining for so many people in the healthcare space, nurses especially, wave after wave. And I like to use that analogy. They said, here comes a new wave of the pandemic of COVID-19. But really, what we saw was kind of a tsunami. It was a gigantic wave. And then it seemed like for a lot of organizations, it stayed there for a very long time. And it's difficult to hold your breath underwater for a sustainable amount of time if you don't get breaks where you can pop up. And I feel like that was a huge component of why we saw so many people leaving the space.
I agree. I think the other side of that was, we're all in it together. We're all in it together. This is great. We're resilient. All right, now we have a mandate, and if you're not in compliance with that mandate, I'm sorry. That's taken a toll as well. So if I've been in this fight with you the entire time, and I've been with this healthcare system X amount of years, and now it all boils down to whether I comply with something that I may not believe in, something that I have doubts in, something I'm not too familiar with. There's not enough science backing it up. Um, and so that's it. And it was heartbreaking. It really was heartbreaking. And so I think that also contributed to, just a different shift in, you know, are we going to pursue this as a career? Or is this something that I really want to do? Um, I can't imagine how many times I've heard, this isn't what I signed up for. Um, and that was all really very real and valid. This isn't something that a lot of people think about, when they heed the call. It was unprecedented. It was uncharted, sort of territory, and we were learning as we were going. And I think that's always really challenging in the healthcare setting, especially just because the industry is so set on best practices, established best practices, protocols. And so learning as you're going, and while holding your breath underwater, is a challenge for sure. And I think this
It
is
really
something
is.
we're really still, you know, still managing and still going through.
How do you feel about the future of HR, especially in spaces like healthcare? What type of things are you hoping for in the future that we kind of are able to accomplish, or are you looking for? What type of changes need to be made? What's your 2 cents on that?
Well, I think that there's a lot. I think there's an entire reinvention that I'd love to see happen. And I think that, again, this year, last year, this year, and I think in the years to come is sort of laying that foundation of a reinvention. Um, but I'd love to see, again, and I mentioned it earlier, just to move away from those sort of very specialized, siloed functions. Um, and it has to be just beyond just kind of a rebrand or a different name. We've heard HR, we've heard people, we've heard employee experience. I'd love to see it, more of solution areas in line with the businesses, and in particular in healthcare, because there's so much opportunity for um, the HR people space to be so integrated with what the business is. Um, and it's happened, but I think there's definitely opportunity for more of that. I'd love to also see intentional job design. I think that creating really meaningful roles instead of just grouping skills and requirements, I think that's something that'll help the HR space just reinvent um, itself and in a really meaningful way contribute to the business, but also just to advocate for those employees. I'd love to also see us tap into or utilize it more, um, just to have talent access within the organization. I think that's a really helpful strategy and approach. So I think there's a lot of things that we will start to see in the coming years in kind of reinventing the HR space, but also going back to those basics and really, what did why am I in HR? My why. And so that why is the driver.
I mean, what got us here definitely will not get us there. And I feel like it's a reinvention of, our approach to how we deal with these people-centric initiatives that's really going to make the difference for the future of work, especially in spaces like healthcare. So I want to use the last seconds here to give you an opportunity to pose a question for our next guest. So what do you got for us, Anna?
I think in light of our conversation, I'd love to ask our next guest, what are some ways that you can advocate for and equip your HR team to contribute optimally to this sort of next chapter in HR?
I love that. Well, once again, I just want to say thank you so much for coming on the HR Heroes podcast. You're the definition of an HR hero from your emphasis on the people, the education, the showing up in a human nature. I feel like is something that we really need to kind of continue to emphasize. And I'm so glad that we have people out there like you who are pushing our businesses forward. So, Anna, thank you so much for coming on the podcast. I really appreciate it.
My absolute pleasure and honor. And Keenan, thank you so much for advocating in this space and highlighting our fellow HR colleagues. We appreciate that partnership and certainly that allyship. And I appreciate the time that you gave me. Thank you.
Well, absolutely. Well, the guys, that's a wrap on our HR Heroes podcast. We'll catch you the next one.